Let's talk about sleeping after a shoulder replacement. First, let's go over the proper positioning of the shoulder sling. A good way to know if your shoulder is in slight flexion is looking to see if the individual is able to see their elbow crease. If the individual cannot see the crease, the arm is too far back. Make sure the elbow crease is within sight to ensure proper positioning. Following a shoulder replacement surgery, the shoulder sling is worn during sleeping, usually for the first 4 to 6 weeks following the shoulder replacement. Some therapists may recommend sleeping in a recliner chair for the first few weeks, as it may be more comfortable and easier to get in and out of. A pillow or towel roll should be placed under the elbow and forearm as needed for comfort to ensure that the shoulder is supported in front of the body, in slight flexion, and in adherence to precautions. Here is a look of proper positioning within a recliner chair. If the individual chooses to sleep in a bed, here are some common mistakes people may make that should be avoided following a shoulder replacement surgery. It is recommended for the individual to get out on the same side of the bed as their non-operated shoulder if possible. Another common mistake an individual may do is try to push up with their operated shoulder. Per shoulder precautions, the individual is not able to put weight on the operated arm, and therefore the movement should be avoided. Now that we've talked about the mistakes we can make during bed mobility, let's talk about the proper body mechanics for getting in and out of a bed with a shoulder replacement. When getting out of bed, the individual should utilize a log rolling technique, making sure that their hips and shoulders stay in line with each other during movement. Once the individual has completely rolled onto their side, they should push up with their non-operated arm and use their core muscles to lift themselves into a sitting position. The individual may need some assistance from family or friends during this movement. If so, family and friends can assist by guiding the non-operated shoulder into a sitting position. To lay back down, follow the same movements as you would getting out of the bed. First, have the individual lay down on their side, and then roll with the shoulders and hips in line into a lying position.